To start with, first of all, congratulations to all of you. This is not like a general Salaah podcast we used to have. It's a happy podcast to have, for say, because all of you have already cleared the exam. And I think for all that, you all should be really proud of yourself, first of all, because that was an year-long difficult journey to go through. So now comes the another part of this whole PG journey, that's counseling. It's as important as clearing this exam. And I feel that 40% of work is done. Now the 60% is left. That is figuring out what could be the right college and right branch for you, because that's going to decide which doctor you will become and what all your learning opportunity you will get. So while we were contemplating a lot about it, that what to create, how to design it, because we were receiving a lot of messages and calls from the student that we need help in finalizing which college and which branch to go. And that's where a lot of mentors comes into the pool and take a call that, okay, let's design it very robust way, that there are mentors who have sit for the counseling last year. They know what goes, the challenges they have to go through with the existing thing exist in the market. And then we have a senior doctors like Sagar and Shubham, who are in their super specialization journey, and some are already working in the system. So they understand the systems from a later point of view. At least they are 3 or 4 years ahead of all of you. So you are going to get into the different perspective, what is important right now for you and what is important for a longer run for you. So I will stop speaking now. I'll just give you a quick introduction and then open the panel for them to talk about and for you to keep asking your question. So I am Astha, co-founder of Salaah Shots, and Salaah Shot is a platform for all of you who is coming here for the first time. Salaah Shot is a platform for all of you to talk to another doctor, because till now doctor is only serving patient. We are creating a community platform for doctors where doctor can talk to another doctor. They can share information, they can help you in whatever the needs, whatever the challenges you must be going through. So with the simple vision of connecting doctor, we started Salaah, and see, here we are, more than 4,000 plus community of doctors, and thank you so much for that. So having that aside, I will pass the stage to Sagar and Shubham. I will introduce them first. So 1 minute, people keep on joining. I just have I'm just getting distracted there. I'm sorry for that. So Shubham is doing his super specialization from AIIMS Delhi. Sagar has completed his general surgery last year, and now he's working as a DMO in Indian Railways. Satrudhan has joined his general medicine last year. He was a last year topper. And Abhay is the one who is helping us since beginning. He's still in college, but such an info kid who is helping us since beginning in filing the data, how the counseling goes. He is doing the NEET UG and PG counselling since last 2 years. So he has good experience there, and he helped us a lot in understanding the space along with mentors. So kudos to the kid, and he is here today to share his experience too. So I'll stop speaking now, and Shubham and Sagar, over to you. So Bhavesh is going to moderate the sessions, and I'm here to help anywhere if it's needed. So Bhavesh is one of you. Bhavesh is a doctor and a very into person who's going to sit for counseling as well, but he is part of Salaah Shots too. So over to you, Bhavesh. Please keep presenting screen, Sagar and Bhavesh. And Shubham, Sagar, you can start the webinar from today. And all of you, keep yourself in mute for now. They will take initial 25-30 minutes to complete the PPT, and you can keep dropping your question in the chat box. And it's my and Bhavesh's responsibility to make sure that all of your questions are answered. I know I speak a lot. I'm so sorry. Bear with me. Chalo, Shubham. Hi, Shubham. Hi, Sagar. Hi, Satrudhan. All of you are on mute except me.
Hello.
Satrudhan, Sagar.
I'm not on mute now.
Oh yeah,
Am I audible?
Yes, you are. I know you are so busy. He was in the duty, and I just pulled him out. Satrudhan, no, please come.
I'm actually on my 20th hour of 36 shift.
I'm so grateful for you to come in, and that's the vision always we have beyond creating this community, that you all should always be eager and ready to help one another. And Satrudhan is showing an example. Sagar to वैसे भी duty से वापस आ गया, and Shubham bhi. So let's thank you to them, but Satrudhan, lot of thank you.
So let's
Okay.
begin the session.
Yeah, please begin the session. I'll mute myself.
Without further ado, I think we are all
Yes.
here. So understand what is basic NEET PG counseling. Why, since we have passed number one step, that is passing the examination, and congratulations to every one of you for passing the examination with merit. As of now, we are here to discuss what to do, what is next after passing the examination, after getting a rank. Does getting a rank equates getting a branch? Does getting a rank means getting equally good college? For that, and what it is all about, this session is about. So the first topic is that the most important question that we get is whether we choose DNB, shall we take MD or MS, shall we do DNB from a peripheral institute or a central institute, shall we take NBEMS Diploma for some of the clinical branches. So as per the MD goes, in MD versus MS goes, I think it's your own inner calling. There was chart that gets circulated in a WhatsApp or one of the Instagram posts, whether you like kids, whether you hate kids, whether you like surgery, whether you hate surgery. If you like surgery, go for the surgical branch. If you hate surgery, go for the physical branch or clinician's branch. If you hate pediatrics, take medicine, something like that. But more importantly, does doing an MD or MS or DNB is worth it, or doing it from any college is important, or is it worth it or not? So the doing MD or MS means building your skill set. At the end of the MD or MS, you will be a specialist doctor. You will be able to see your own setup. You will be going to for SR position or academic position. You are going into various other professional careers again and again. So I believe taking the first step, whether doing MD or MS, it stays with you. Whether doing DNB, it does not necessarily makes difference in your career with respect to MD versus DNB. Now, for DNB, I feel Sagar will be able to better tell how the DNB curriculum works and how his DNB exposure was there. Was it any difference from someone who did a MS from a central institute?
Yeah. So talking about the DNB, the most people have the doubt, the first and most important doubt about the pass rate. Because I've received so many messages, those who are appealing for the NEET PG counseling this year, that what about the pass rate? But I'm telling you what the pass rate thing is, that if you are studying in whole 3 years, you are attending your clinics and you are doing all the basic thing what we need to do in the wards, then definitely 50% of your questions will be covered in your ward. It's the same for if you're taking MDMS or DNB. The main thing is that we need to be so much of enthused for going into the ward and looking after the patients and staying in the ward till you finish your work. Because in DNB, it's not compulsory to stay throughout the night and day. There will be less hectic thing in DNB as compared to MDMS. And next thing, most of you talk about DNB is regarding the surgical branches and the medicinal branches. So most of you know about the surgical. Most of you will not prefer surgical branches in DNB courses in the private hospitals. And it's according to me also, if you are planning to take surgical branches in DNB, it's better to avoid the corporate branches at end. You can try to go for the central institutes, central government hospital or state government hospitals, and in the last you can try for the trust hospitals if you are going for the surgical branches. Because I'm going to share my experience with you all. Like I have done my DNB surgery from BRC Hospital, Eastern Railway, Kolkata, and from day one we are going to the OTs and we are looking after the ward, and we have very less people as compared to the MS people, those who have more than 10 or 12 seats per year in medical college. We have just 2 people were there. So I am looking after the whole female ward, and my colleague is looking after the whole male ward. So total 70-80 patients will be looking after by me single hand, and that the same with my colleague. So, and the same with the OT thing also. We are attending OT from day one, and after the 3 years, we have got so much of exposure, like it's better than most of the MS colleges. Just like I'm gonna share like all the laparoscopic exposures which I got, like lap appendicectomy, cholecystectomy, lap hernia, and we also got a chance to see the lap hemicolectomy and all. So these are the basic things which I want to convey with you, that at DNB most people think like that they will not gonna pass easily. Thing is that, but there are most of the branches are there which you can pass if you study well and if you're going to focus on all the clinical part.
So I believe that with respect to medicine, I'm not sure about how surgical branches goes in MD versus MS or versus DNB. For medicine branch, I feel it does not actually make any difference. If you are pursuing a DNB from a reputed center, I have many juniors who have either opted DNB over MD. One most important reason is that there is a bond in MDs. So most of us are looking for DM post MDs. For most of the branches, per se, if I speak about MD pediatrics or MD medicine, we allow for both pediatrics and medicine, there is a super specialty curriculum for most of the branches now, from pediatric neurology to clinical hematology, from adult and pediatrics both. I believe doing a degree, be it an MD or a DNB, with a right skill set, with a right exposure hospital that does not look for a degree label, look for an institute and exposure. If you have a right exposure, right academic curriculum, choose that particular branch. Also, keep in mind how you are going to make this degree better, right? Because I believe doing MD have its own importance, have its own recognition pan-India. Reason being, conventionally when we see MDs, there is always a divide between MDs and DNB. The way we look the medical profession, that he's an MD or he's a DNB. That difference is decreasing downside. Previously, what used to happen was the DNB was a separate examination and the people who were not getting any seat in MDs were choosing DNBs. So the passing rates of those particular students were low. Now that the toppers are choosing DNBs, the passing rates have considerably increased. At the same time, there are some institutions which offer DNB and they have an excellent academic curriculum. So we need to find out which hospitals and which corporate hospitals. I have also found, while speaking to the other colleagues, the DNB corporate in a DNB institute, the consultants are more friendly as compared to the conventional professors, right? So the overall environment needs to be nurturing. And that is being, wherever you get that, you should opt for that particular branch or that particular seat. For NBEMS Diploma, I believe, there are some particular branches like radiology, pediatrics, orthopedics. There are post DNB options. And at the same time, you can just cut your degree just by doing NBEMS Diploma also. Post NBEMS Diploma, there is a secondary DNB and you can complete your post, you can be an equivalent DNB post completing the post, if only post, post diploma, you can do a secondary DNB and then you'll be equivalent to a DNB candidate as per as the joining as an SR position or AP position for future perspective. And if you want to join in an academic position in the government hospital. One who should go behind NBEMS Diploma is when I have a junior, he had some rank 5 or 6,000. He only wanted radiology. So he chose diploma radiology over anything else. So if you are very sure about a particular branch, then degree actually doesn't matter. Whether you are doing BNB, diploma or MD, right? So
Satrudhan, what is your view on this? Because last year you also must have come across this question that should I go for DNB or MD, because everybody is going through it right now.
See, because I will speak in Hindi, I'm really sorry.
Please
I'm
go
really
ahead. Just like
comfortable
language is just a tool to talk. Hindi, English,
I don't know now, only North Indians are there or not.
It's okay.
The thing is कि मेरे लिए जो DNB versus MD था, because I have chosen DNB medicine in one of my home institute, मतलब where my home place is, I've chosen that DNB medicine over MD in my first stage of counseling, because I think many factors are there to choose between the ranks, क्योंकि बहुत सारी चीजें आ जाती हैं. आप अभी सोच रहे हैं रैंक है, उसके बाद आप होम स्टे ढूंढेंगे, बहुत सारी चीजें ढूंढेंगे, मेन आपका फोकस ब्रांच पे रहता है. तो DNB और MD मेरे लिए मैटर नहीं करता था, मेरे लिए मैटर करता था मेडिसिन. I want to go in medicine and whatever be the best possible option I will get at my rank, I will choose it. But the thing is कि DNB, MD जैसा शुभम सर ने कहा कि it doesn't matter in my kind of branch. Like medicine and pediatrics में DNB medicine का DNB और MD का कोई इतना point of view रहा नहीं. पहले बहुत था. it was a huge difference. Okay, I will speak in English. Sorry. Uh, Earlier, it used to have a huge marked difference between DNB ranks and MD ranks, but many of MD seats are being left out at a lower rank, and DNB seats are getting picked up by more higher ranks, like Hindu Rao, Holy Family, PD Sindhuja, many 20, 30 corporate hospitals and many better hospitals. Sir Gangaram, it got picked at around 1,000 rank, and 900 rank was really great. So not much difference is left now between DNB and MD. As far as surgical branches, I know surgical branches you have to consider. Still, you have to consider whether you are taking DNB or MD, because in medicine, in a branch like medicine, no one can teach you much more than you need the freedom. You will study and you will experiment. I think
need that decisiveness, whether
Yeah.
you are an observer, whether you are an active decision maker.
So I just want, there's one question by Ashish Yadav for DNB institutes. How many number of beds matter? Like some are 200 bedded, some 300, some 500. So what thing to be kept while choosing DNB institute?
Yeah,
Like
earlier it was needed for getting equivalent to MDMS was 500 bed, but recently in June only the NMC has given a guideline that now they are taking it for greater than 220 bed. So, and they have changed so many criteria regarding like earlier it was 500 bedded, now it changed to 220, and other things were there which many people don't know about while taking the DNB. I'm going to quote these things, and you should take care of that. Key while taking DNB institutes, you should query about these things also, because it will make you equivalent to MDMS. The first and most important things, in which institute you are taking, there should be 30 beds per unit of broad specialty, and 20 beds per unit of super specialty should be there for making it equivalent to the MDMS. And all the total beds of that hospital, 50% beds will be the teaching beds. And whatever the consultant will be in that your DNB hospital, one of the 3 supervisors must meet the NMC norms for postgraduate teachers. These are the 3 most important things you should take care of while choosing DNB, because all these things will nobody is going to tell you. And after passing the DNB thing, you'll get to know in my hospital these things were lacking. So
okay.
While getting
So Neeta also have a question that Neeta Sukumar, that please consider this question, that I'm confused between DCH and then doing the secondary DNB or straight doing the MD psychiatry.
that was it.
Pediatrics and psychiatry, they are altogether very different branch.
No, like DCH, then doing secondary DNB or MD psychiatry.
So
She's
DCH
confused
is-
between these two things.
Correct me if I'm wrong. DCH is Diploma in Child Health. Right?
Yeah.
Right?
Yeah.
So,
Yeah.
Pediatrics.
Yeah.
So
Yeah.
someone having a patience of dealing pediatrics at the same time, the pediatrics and psychiatry are very different branch. Okay.
2 separate.
I believe if you really like going to pediatrics, there are so many options open. You can go ahead with Diploma Child Health, right? But if you really like talking, if you really want to go ahead with the mental health problem, however, it's very aware in between Metro 1, 2 with government schemes. The psychiatry branch is the most blooming branch among the lesser chosen branch, right? So you need to decide what kind of person you are. Do you really want to keep yourself whole night? Because the pediatric ICUs are one of the most busiest night duties, even post SR shift. At the SR level also, like I did my MD from Harding. So Kalavati is one of the busiest pediatric hospital in India, right? That in that particular hospital, my friends in their SR, they used to work 12-hour shift, even in their SR shift. When it goes to psychiatric or psychiatry department, so it's comparatively a work-life balance and lifestyle balanced branch. And it's a very different branch. It's
Okay. So there are 2 questions together. One from the Malleshwar Raju and Ekta Punia. One is asking good Institute of DNB General Surgery in Mumbai, and one is asking for DNB surgery in Delhi. Good institute, they're asking.
Yeah, we're going to discuss all these things in upcoming webinars. So we're going to tell you each and every details in upcoming webinars. So I think you should wait for just a few more days.
And there's one more question that by the Dr. Sapna Thakkar, that what is the difference between NB diploma and other diploma?
Sorry?
There are 2 the two boards are there. One is the National Medical Council, and other is the NBE. So most of the diploma seats in the medical colleges are now getting converted into MDMS, and they are taking the diploma seats in district hospitals and the other government hospitals and other private hospitals. They are making NBES diploma seats. So if some medical colleges have left with the diploma seats, in upcoming years they're going to convert those diploma seats into the MDMS. So I don't think so. Is there any difference? Because in both the things you need to do the post diploma DNB to making it equivalent to DNB or MDMS.
Okay, so one question by Surbhi Kumari, that what about the ophthalmology after MS, job vacancy, SRship, and some good institute for ophthalmology?
So I
Yes,
think
same. In upcoming session for the ophthalmology, we will discuss.
Just briefly to answer it. Okay. Here we are surgeon, medicine. Three people are sitting. We are not really an ophthalmologist. However, we know the overall market. What are the job positions? Don't look. I really like to congratulate you on your question. The approach towards choosing a branch. That is what we want to discuss next. While choosing a branch, you should be very clear on prospects post your branch, because you are choosing a branch to get a job, not choosing a branch otherwise, right? So the whole discussion of this series of webinars is to help you reach a decision with wisdom, well informed, and without any regrets.
Okay. So one question by Rohit Krishna, that hello, I have secured a rank of 450 this NEET PG. I'm passionate about surgery, but I am a bit apprehensive about my health issues, like I have varicose vein and asthma. Will taking surgery worsen my health? Like surgery demands long hours of standing.
Yeah, definitely.
Yes,
It
it will.
demands, and starting with just MS surgery, you need to go for the super specialization also. So definitely it demands a lot of standing and a lot of active work. So you should think about this again, and according to me, you should think about this again.
I have
Then
to
also have a
add
point,
something
yes,
in,
Yeah,
because
yes, sir.
last year this was my also problem. Last year I had the similar problem in my, in fact, my core branch from my heart, passionate branch, which we would like to say is surgery. But last year during my drop year, I had some health issues, and I was diagnosed, okay, I have developing callus and varicose vein, just like the Rohit guy. And so I choose the lesser workload branch. I choose medicine. I'm not saying it is lesser than surgery. Matlab, it's comparatively lesser than surgery. I
Yeah,
don't
you can
have to
sit and work.
stand. I can sit. I can sit and I can whine about my life, but I don't have to stand.
but Satrudhan, medicine is also a lot of
I mean,
one of
medicine
the
is hectic. It is
hectic
very
branch.
hectic, but
But
it is
is not
hectic from
physically
here. It's not. I
It's,
have
it's
to
not
build up my
physically demanding. The surgery
physically that much
particular
demanding.
branches are physically demanding branch. Medicine is not physically demanding. It needs
Man-
it needs there are two types of toxicities. One is academic toxicity. Okay. One is leg work toxicity. Surgeons are more prone to leg work toxicity, the back aches and the leg aches. And the medicine people, they are more prone to harassment in rounds. And more
Headaches.
importantly, the eccentricity that it builds on. You need to read. The Harrison is not enough, and something like that.
Yeah, so on this, let's talk about branches, because lot of question is coming. First, starting with what you are saying, Subham, ki your approach to decide a branch for your career is very important, irrespective of which is going to be in demand and which is not going to be in demand. Approach to this is very important, because you're going to this is going to become a very crucial part of your life. So what approach anybody should have in deciding and which branch to go for, even to finalize in 2-3 branch to go ahead with.
Sorry, Astha.
Oh, sorry. So am I audible?
You're audible. I'm really sorry. I couldn't get the question.
Approach, how to take the branch.
So I believe that in the end, the approach to branches, you need to question yourself. The three questions needs to be asked. One, like, do you want a clinical versus paraclinical branch? Do you need a surgical versus non-surgical branch? One. how do you want to live your life in general? Are you a layback person? Do you want to travel? Do you like to sit in wards? Second question. Third, what kind of patient load you want to take in? Right? These are the three questions you need to ask before choosing a branch for yourself. Then at the same question, what kind of what kind of branch in the context of college? Does this college offers me a good patient load or not? Secondly, does it gives me a hands-on training with respect to surgical and medicine procedure wise? On all the branches, there has to be a hands-on training, whether it's a hands-on training versus observership role. Third question is whether whatever branch that you are taking in, what are the examination pattern when it comes to DNB and what are the passing rates? And the fourth question is how is the faculty approachable or not for that particular branch? Wherever in particular college, are the faculties approachable or not? So this will be my take. Sagar, do you have any other things to add on?
Yeah, starting with the thing, just as a surgeon, I just want to request everyone, if you got lower rank and you are thinking of taking surgery, chalo, I got lower rank and I'll take surgery, don't take it. If really you want to be surgeon, then only take this branch because it demands a lot from you, which I have experienced in last 3 years. So first I start with it. And second, if you want to take any branch, the first and most important thing you should remember, you should forget about all the things like location and the college. The main important thing is the branch, because after 10 or 20 years, what we're going to carry with you is the branch only. So if you really love pediatrics and you are getting DCH, go for it. If you are really love medicine and you are getting DNB medicine in any good hospital, go for it. Don't think about that, I'm going to take a drop and then I again prepare for getting MD. Don't run behind MD or don't run behind any degree type. Always think about the branch before going for anything. So this is my take, Satudhan.
Many DNBs are better than MD in branch-wide selection of. So maybe, but mera ek hi tha, have a thorough research. Okay, whether you are taking MD or DNB, don't take counseling lightly. This is a single advice. You have taken very much serious this competition of NEET PG. Don't relax. Okay, I don't want to panic you, but many times all the hard work you have done for the past year, na, 200, 300 people are gonna get the black sheep in the counseling. They will have great rank. They will have everything. They have done their work, but they will not get their choice of branch or choice of college. If you have done that hard work, kindly, it's a request, please carry through the same precision and say, don't party karo, okay? You should enjoy your life for the next few days, but take it serious, man. Counseling is just like Asta said, counseling is 60% of what you are getting. One of my colleagues has 18,000 rank and he is doing MD medicine. Many are don't. He is a general candidate. I'll tell you. So counseling is a game changer. If you take it serious,
I think
become an opportunistic infection in regards of counseling. You can get anything and you will get nothing if you are not serious.
Yes, Satudhan, you can quote one or two example of yours. What suffered you last year?
I suffered. I did not suffer because I take it seriously. I take it very seriously because I was so much panicked about my counseling. I have great rank, but it's not a great rank to get medicine. Okay, 3,000 rank or 4,000 rank, all will consider, okay, I will get medicine. 5,000 rank people, I will get medicine or radio. No, you will not. I'll tell you honestly, you will get FOMO. You will get caught up in all the counselors and it. You will not do your own research. You will lack in your own research. You will not contact the residents. You will become lazy in contacting them. Okay, I have to get contact from Holy Family. I have to make a list. I have to choose my own list. You will lag. I'll tell you will lag. Please don't. Because it will suffer. सब कुछ करने के बाद भी नहीं मिला. क्या किया? Take Salaah shots that are serious. Okay.
I think Truhan ये
जो भी
बोलना
data
चाह रहा है कि before taking your branch, you need to research very carefully about the branch, about the college that you are taking that branch, whether it's MD or DNB, about what is the bond status, what is the salary status, what are the hostel status, what is the mess status, how your colleagues are, how much, how far do I have to travel before getting back to my home? If I get 2 days leave, do I need to travel 1 day? Do I need to spend 1 day in a travel only? Right? All these questions are important while choosing a branch. It's not just academics. Academics is one part. You will enter a branch, you will pass that branch, you will pursue and practice that branch. But you don't need to be miserable. मेरे को कोई बोलता था कि आप एमडी जो है, मतलब आप जब कोई भी एक स्टेप पायदान ऊपर चढ़ते हो अपने एमबीबीएस से एमडी, एमडी से डीएम पे, तो आप अपनी मिजरी कम करने के लिए चढ़ते हो, है ना? अगर आप अपने आप को और मिजरेबल बना रहे हो उस पूरे प्रोसेस में, तो व्हाट यू आर डूइंग इज यू आर डूइंग एब्सोल्युटली रॉन्ग। हमको नया पायदान चढ़ना है अपना मिजरी कम करने के लिए। At the same point of time, before concluding this part, I need to tell you, don't take drops. Find yourself a branch. Find the passion needs to find you. You will find your passion. Trust me. Taking a drop, going through all that process, the next year, maybe certainty, maybe uncertainty, but as they say, as they used to tell me, the only person who is satisfied with their rank and branch is rank 1. So be rank 1 or just take a drop.
Shubham is saying all this because he is rank 1.
No,
Only rank 1 people talk about all this thing. Don't listen. All what happened to rank 1
No, that is
सारे टॉपर शत्रुघ्न यही बातें करते हैं, लेकिन मैं बता रही हूँ रैंक 1 वाले।
I can't relate. I never relate. I don't want to relate in whole life. I'll be above average and live.
Point being is that it's about satisfaction. But does satisfaction correlates with success? No. It's a ego fulfillment. ठीक है, तो we are egoistic people, Shत्रुघ्न.
Medicine branch people are really egotistic.
So
how is the radio and Dharma people?
So
same egoistic.
No, they are not egoistic.
They're happy. Doctors, they're happy. Oh.
They're happy.
So let me give everybody who's coming here for the first time the disclaimer. I am an engineer in this whole loop of doctors. तो मैं रोज आप लोगों से सीख रही हूँ ये चीजें. So it's a fun for me. Yeah, continue, please.
Yeah, moving with the next thing.
So the impact factors, I think the most important, I think we have already discussed this. It is a location of your branch or your college particularly. Now what we are discussing is कि आपने already branch अपना choose कर लिया हुआ है, आपको अब fix हो गया है कि आप सर्जरी करना चाहते हो, आप pediatrics या डिप्लोमा करना चाहते हो. अब आप अपना सेटअप फाइनलाइज कर रहे हो, है ना, कि मेट्रो में करना है, पेरिफेरी में करना है, सेंट्रल इंस्टीट्यूट में करना है, बॉन्डेड इंस्टीट्यूट में करना है, नॉन बॉन्डेड इंस्टीट्यूट में करना है, नया गवर्नमेंट या ओल्ड प्राइवेट में करना है, ये सारी बातें. तो मेट्रो वर्सेस पेरिफेरल सबके अपने अपने एडवांटेजेस हैं, अपने अपने डिसएडवांटेजेस हैं. आई थिंक द राइट फिट इज द फिट विच फिट्स यू, है ना, योर रिक्वायरमेंट. आई कैन नॉट टेल यू कि आपका रिक्वायरमेंट क्या है ना, जो आपके रिक्वायरमेंट में फिट बैठ रहा हुआ है. सो इम्पैक्ट फैक्टर्स विद रेस्पेक्ट टू लोकेशन का मेरे हिसाब से अगर मैं अपनी बात करूं तो आपका मेंटल हेल्थ और लाइफस्टाइल के साथ में अलाइन होना चाहिए. ठीक है, अगर मैं ऐसा कंक्लूड करूं. बाकी सागर आपका कुछ है?
While choosing for this मतलब different factors while going for choosing any branch, मेरे हिसाब से if we'll talk about the DNB thing, I'll give an example. I'll share an example with you that when I went for my DNB practical exam in NEEMS Delhi, so I met so many people who has done their DNB from, who also came for the practical and has done their DNB from peripheral state district hospitals. The problem is that they have chosen that district hospitals for getting a good hands-on. But what they are telling is most of the emergency cases are referred to the medical college. So they are just doing the elective cases and they are not getting laparoscopic hands-on and all. So while choosing this thing, you need to take care of that institute is in metro or is in peripheral. So always go for the metro hospitals if you're going for the surgical branches, and it should be government hospital so that you will get more hands-on. I'm talking about the new government or private. In DNB, if you're choosing medicinal brand, always go for the big corporate hospitals, because you will get to see so many varieties of cases which you're going to miss in peripheral medical colleges. It's for sure, because lots of many friends have taken these things, and they are very happy that they have taken the DNB medicine in metro cities and big corporate hospitals. And about the Shubham has told about the location and all things. So most of the people are not thinking about the location, and most of the people will think about the location, because if you are taking some very hectic branch, so you should be near to your home, so that you can at least get 1 or 2 days to visit your home, and you will feel relaxed. So, and if you are living far away from home side, and the department is also toxic, you are not getting time to live with that, then you're definitely gonna feel lonely, and for the first 6 months, it will be very miserable for you.
If you're more prone to homesick, choose a place which is close to your home, or at least a 1 flight away, right? You need to identify कि आपके अपने pros and cons क्या है ना? अगर आप देखो, आपसे ज्यादा बेहतर मेरे को नहीं लगता कोई अपने आप को कोई समझता है. तो आपको पता है कि आप पर्टिकुलर प्रेशर में या नॉन प्रेशर, क्योंकि रेसिडेंसी इज a 3-year time, and it can be and burnouts are real, homesickness is real, and we are humans only, we tend to get homesick, है ना? कोई बचपन से कितना ही बाहर रहा, मैं जैसे बचपन से बाहर हूं, but still I tend to get homesick. There are times when we get burned out, and if not, I just want to go back to my home, meet my friends, family for 1 day. That break is required. And the leaves that we get are hardly 2 days or 3 days, particularly in hectic branches. In those 2 or 3 days, you don't want to keep on wasting time while traveling only, है ना? You need to have some. You don't need to punish yourself. You are choosing a degree. It can be done with your own convenience also.
Yeah. I want to add more thing, like DNB में just like in NBEMS you are doing in medical college, वहाँ पे बहुत सारे लोग मिल जाते हैं, interns मिल जाएंगे, बाकी department के colleagues मिल जाएंगे, लेकिन in talking about the DNB, there will be very less people over there. तो ऐसा चूज करना है, मतलब अपने घर के थोड़ा नजदीक हो, जिससे कि यू कैन विजिट योर होम, बिकॉज खुद के हॉस्पिटल में लोग नहीं मिलेंगे बात करने के, क्योंकि तुम्हारे कलीग ही 1 या 2 होंगे, तो क्या पता उनसे तुम्हारा अच्छे से बने या ना बने. तो थिंक अबाउट दिस.
So as far as my take on the impact factors is, you should talk to, मतलब take 2-3 criteria. कैसे research करना, how to ask it. Just go and ask the residents. You will get the numbers from somewhere on the Facebook, and all the older residents are on Facebook. Okay, you will not find them on Instagram. I used to do it. Okay, I will search the home page of some college or an institute or a DNB, and all the residents group and the consultants, mainly consultants, are on the Facebook.
अब इतना परेशान नहीं होना पड़ेगा. This is one of the biggest pain point people have.
But the thing is, it is very hectic to do. But I am so glad this platform has done this. The most hectic thing here, which confuses me, कि contacts नहीं मिलते, and genuine people नहीं मिलते, wrong numbers and all the things. So you have to research that. Regarding the metro versus peripheral, for the surgical end branches and medicine branch, the debate is same. And like sir has said, Shubham sir has said कि okay, homesick तो सब होते हैं, मैं भी हो रहा हूँ. I am also getting homesick for the past, I don't know how many months. But the thing is, please choose wisely regarding the metro and peripheral, because first year residency is for 1 year, and 3-year residency you have to sustain. जितना भी trauma, whatever you think about the college, one thing you should know कि 2 साल और भी. First year के हिसाब से complete decision मत लो. Metro cities and peripheral cities should matter to you. And new government and old private also matter. It is a very important point to get confused, okay? Because old private institutes, many rankings are getting down in Delhi itself. BC Gupta and St. Stephen, many asked. The load was great, the academics was great, but now it is getting lower in the lower side. So newer trends of the DNB seats criteria will change. So this app will help you, or Salaah platform will help you. You have to get in contact with the resident at present. 4 साल पहले, which resident was there, he will have a different scenario because the consultant was different. Now the consultant will be different because the newer consultant will be in new government hospital. So you have to research that. That is research in this new
Thank you,
government and
Satyadeep, for
hospital.
that. But yeah, so the same point, na, jo pain problem hai to figure out the resident from different colleges, even to figure it out DNB, how the DNB is there or how MD medicine is there. So the way Satrudhan right now you can reach out to from Salaah platform, the place he is doing his MD medicine, you can get all information about that college. So we are compiling a lot of mentors sitting at different colleges all over India, be it DNB or be it MD medicine or be it diploma. You can have a one-on-one session with them to discuss about that. Will this requirement suits me or not? Because that's a very important question to know. Because Satrudhan ko bhi surgery karni thi, but his physical condition didn't allow him to go for that. So medicine was a choice. So in general, choosing the branches sometimes comes at a cost of what fits me as a person, what fits my requirement. So having a one-on-one sessions really solves a lot. So we are working on that. It's already live. You can go and figure out your mentor from whichever college and have a one-on-one and make a wise decision that whether I should go for that college or not. Yes, over to you. Quota strategy.
Yeah.
So basically the do's and don'ts of round strategy making, basically now that you have chosen your branch, you have chosen your college, you have chosen your college location. Now that you have decided to fill in the choices in the order, now these are my priorities, number 1, 2, 3 to hundreds, depending upon your rank. So the most important is not counseling is equal to strategy. It does not just filling choices. You have to have fill choices in order that you really want to go ahead with. Do not leave blanks. Do not think that you will get upgraded in the second round. Whatever, it's a very simple common sense. You will have more seats in round 1 than round 2. There are very less chance of upgradation for round 2. Whatever you want to fill in, don't wait for round 2 or round 3 or mock sessions. Give your best as per your rank and your choices in the round 1 only. Now that the things are also changing with respect to the all India state quota, at the same point of time, the bonds versus non-bond status, that is something needs to be understood at the time of filling choices, depending upon if you really want to go ahead with the bond and with a particular institute. Sagar?
Yeah, Abhay will take on this. Yeah, Abhay.
Yeah. Yes, sir. Yeah, sir. The most important part of this is, as everybody we are deciding that which branch I will get and what we have done all the things. The first thing we have to matter is the counseling. Sir, as the counseling is a strategy and not just a filling choice, sir, is the most important part as what the Shatrughan sir has said that in the counseling we have to totally engross, right? Sir, that we are thinking of that I will get MD pediatrics or MD medicine, but sir, how will we getting it? First, we have to got the allotment letter in our hand to getting into the college and got to the admission process. So, sir, the counseling is the most important part, sir. As the all the people are here are the doctors, they have given the NEET PG exam. The counseling is same as the NEET UG. There is a big difference that in our counseling, two counseling are there. One is all India quota and other is the state quota. So, for example, let's take the example of SMS Jaipur. If there in anesthesia, there are 4 seats, okay, in total. So the 2 seats will be filled by the All India Counseling and 2 seats will be filled by the state quota. So the two simultaneously take place, not together they will take place. First the All India quota round 1 will take place. After that the state round 1 will take place. So that there is no seat blocking will be going to be there. Okay, and the second thing is that at the time of filling the choice, as the Subham sir has said, you think of the bond versus non bond. So this is the most common thing कि पता नहीं चल पाता कि इस कॉलेज में बॉन्ड है नहीं है और कितना है. तो इसके लिए सबसे इजी प्रोसेस ये है कि जब आप एमसीसी की वेबसाइट है www.mcc.nic.in, वहाँ पे आप जाओगे पीजी में, तो वहाँ पे जितनी भी कॉलेज पार्टिसिपेटिंग इंस्टीट्यूट है, जैसे भी यूजी की काउंसलिंग चल रही है, मैं मॉडरेट कर रहा हूँ, पीजी का भी लास्ट ईयर किया था मैंने पूरा मॉडरेट, सलाह सर की हेल्प से और सागर सर की हेल्प से। तो वहाँ पे जाके आपको कॉलेज का नेम मिल जाएगा और उसी के साथ वहाँ पे वो दिखाता है बॉन्ड स्टेटस। तो अगर वो दिखा रहा है व्यू बॉन्ड, तो मतलब उस कॉलेज में बॉन्ड है, और अगर वो दिखा रहा है नो नो बॉन्ड या नॉट अवेलेबल, तो उस कॉलेज में बॉन्ड नहीं है। अब जैसे शत्रुघ्न सर ने एक बात की, फ्रेंड जनरल कैटेगरी से उसको रैंक पे एमडी मेडिसिन मिल गया। सर मैं मेरा लाइव एक्सपीरियंस बता रहा हूँ, मैं नेम नहीं बोलूंगा, बस टॉप 10 में लास्ट ईयर जो टॉप रैंकर्स थे उनमें से एमडी रेडियो चाहिए था बीएमएमसी सफदरजंग से, लेकिन बाय मिस्टेक पुट का एचएफ। अब सर बात यह है कि बीएमएमसी सफदरजंग में वो फील हो, की बात है नवंबर में कोई क्यों ही छोड़ेगा, जैसा भी शुभम सर ने कहा बैकअप रखना है, नहीं छोड़ना है। इम्पोर्टेंट कि आप टॉप रैंक के बाद दोगे तो आप ब्रांच रह जाएगी। आपने चाहे तैयारी पूरी कर ली एकदम, आप मस्त तैयार हुए कि भाई मैं तो एमडी पीडियाट्रिक्स ले रहा हूँ, लेकिन अगर आपने फिलिंग में गलती कर दी, आपने अपडेट्स में गलती कर दी, तो सर उसका कोई फेस सॉल्यूशन नहीं है। और सर आप ब्रांच में तो सर
just one second,
मेहनत
Abhay. What Shatrughan sir think about this, like all over the mistakes, and how can it be avoided?
Sir, the basic rule is to read the rule book. NEET PG counseling की एक rule book आती है. They will post it. Okay. Every question, every doubt, and everything will be answered if you are not lazy and you read the whole prospectus of NEET PG counseling. You, I think we will have a webinar on that also, if possible. All the rules should be given in a crisp format and highlighted. But I will recommend all people who are participating in counseling should read it yourself. Get a PDF copy and you should read it and get yourself updated, because it will change drastically on a daily basis. In the later rounds, it will change on hourly basis. Let me tell you, it will change on hourly basis. After 2 years, there will be new update, and some seats will be getting new and some seats will be cancelled. This will happen in round 2 and round 3 and mop-up rounds. So my suggestion is round 1 is your choice, and rest is God's plan. Okay. If you can get a college in round 1.
I want to add one more thing. Like this year, just the Supreme Court has removed that changes the domicile quota thing. Like if you're belonging to some state, earlier years, previous years counseling, those people are belonging to that particular state as a home. They are getting the state quota thing. But Supreme Court has removed this state quota based on domicile. So I think from this year, there will be no domicile-based state quota. Those people has done the MBBS from that particular quota, particular state, those people will get those state quota thing. So I think Supreme Court has already given their decision, but we are waiting for the prospectus of the NEET PG counseling to confirm it. So let's wait for that prospectus.
Yeah, and just one thing to cover here ना, Satsudin, वो कैसा था कि if you'll get a seat in round 1 and you apply for upgradation, तो वो next round 2 में you haven't got a college. For this whole process is, एक बार वो बता दीजिए ना.
See, the process is all India first round will happen, and the maximum seats will get picked up. Like Shubham sir has said, okay, you will not get upgradation in round 2 after round 2. It is rarely happening. If people already booked the seats, will not get a better choice. You will not get their choice. Okay. So round 1 is the final round. Take it as a final round. You should just safe play in that regard. After round 1 of all India, the state first round will happen. And on the similar rank, because last year similar rank basis पे ही first round की state की भी ranks उठ गई थी. And after that, the game actually starts from round 2 and round 3. During that period, each and every state will have different timeline gap in between them. They will post their, okay, we will be having the results issued after 3 days, or we will be taking the choice filling after 2 days. So there will be a lot of time clashes in between them. Okay. So what can prevent all the common mistakes which will happen in that hot coach round 2, round 3, state round 2, state round 3 is you whatever that you have set up for your own, whatever the criteria you are thinking, okay, location, branch, college, institute, okay, my own, whatever my thinking is, okay, my girlfriend is in that college, I will put it on the upper one. This is also a criteria. I'll tell you, this can be a criteria. Okay, we both are studying and we are both cracked the NEET PG. We will both go to same college. So this is a criteria you can have. So whatever criteria you are having, okay, you should make a priority list and stick to that list and play it safe. That will keep you out from FOMO. And do a thorough research with Salaah Short's contact with residents, and you will get yourself out of this FOMO. Positive shift, negative shift, it doesn't matter to you. If you get a rank, if you are getting a seat in round 1, you will feel safe. After cracking the NEET PG, you did not feel happy. You feel satisfied. You feel relaxed. Okay. You need to feel relaxed in the counseling. So get yourself a seat in round 1 and then play the game. Okay, I'll get the upgradation or not. I'll decide later. Okay, but this seat I am getting a seat. So the only question you need to answer is मेरे को सीट लेनी है या नहीं लेनी, ठीक है? लेनी है तो मेरे को फर्स्ट राउंड में ले लेनी है और आगे देख लो. I'll see it. If upgrade will happen, it will happen. But the maximum or the worst mistake would be happen to you is, okay, I am waiting and I am waiting. A negative shift, positive shift. I am seeing the trends. Nothing is happening, and I am preparing for the exam next year. Okay, this is the worst case scenario. Please avoid it. Okay.
Right. Well said, Satruddin. Sagar, एक बार go back to the last slide now. Last to last one. I think let's cover one important component. Make one more slide back. Yes, the branch dilemma. I think there's a lot of questions around the branches, the emerging branches. Can we just cover a bit about it? So, Shubham, because up to hospital, you are coming across the new branches people are doing, that radio onco and the nuclear, aerospace. Like just about, let's talk about it, because people do have that question in mind.
Yeah. I'll just add one point, then Shubham will continue. I just know a few examples regarding the radio oncology part, because a few of my friends and a few of my seniors has taken and they are feeling satisfied. Because this radio oncology, you have a option of doing the medical oncology super specialization, and in upcoming years, the government is going to put the oncology department in each district hospital. So you'll have more chances of getting your department in the district hospitals also, because they are more planning to have a more chemotherapy and radiotherapy thing in district hospital level. So that will be easy for the peoples, because as the cancer cases are increasing in all over India, so government has planned this thing. So if you are interested, so radio oncology is a very good branch, you can take it. And most of the people like a chill branch, 9-to-5 job and all. So this is one of the best branch if you want to be very chill and you want your work-life balance thing, like most of the people are taking in radio and derma. Yeah, over to you.
So for the emerging branch, radiation oncology, transfusion medicine, geriatric medicine, nuclear medicine, these are the few to name many. As I am an oncologist myself, as Sagar told that I have worked as a house fellow as a medical onc also, and now I'm doing clinical hemat. Radiation oncology is one of the best branches. It is, as say, the oncology is the new cardiology, right? We have some 27 to 28 regional cancer centers. When I tell you this, hardly in 18 there are medical oncologists. Rest of all are managed by radiation oncologists. Even in Delhi, there is medical oncology only in AIIMS, and radiation oncology being managed in both of the hospitals, Delhi Cancer Estate and MEMS too, right? The whole of the oncology are being managed by radiation oncologists. Post radiation oncology, you can, now that in NEET SS, the common entrance examination for NEET SS is via radiation oncology only. There is a base broad specialty where the radiation oncologists have an edge over a medicine people for medical oncology in needs SS super specialties. At the same point of time, I am MD medicine graduate. When I first entered into an oncology setup, I had absolutely no idea because we do not have much of an exposure regarding oncology in a medicine teaching hospital. But radiation oncologists, they see in and out of oncology, and one who really is fascinated about this branch at the same point of time, who really want to get assured about ki post MD, I'll have some kind of assurity for placement for job. Radiation oncology is one very good branch. Second is nuclear medicine. When it comes to oncology, here only nuclear medicine. For PET scan at the same time, therapeutics and diagnostics both for nuclear medicine. The pro points is the nuclear medicine primarily is being corporate based. There are not very academic positions on that. At the same point of time, it's metro based also. If when it comes to tier 1 cities, tier 2 cities and capital cities, where there is an oncology setup, you will require a nuclear medicine setup. Transfusion medicine is being previously the pathology used to set the blood banks. Now transfusion medicine is mandatory in most of the blood banks. It is starting from the national hospitals, like from the Delhi hospitals or the big hospitals. Jaise emergency medicine hai, now that has taken over, right? Emergency medicine is also one very good branch. Let's say if you want clinical branch, but you are not getting medicine at the same point of time, you hit anesthesia. So you take you don't want to be on the back seat. I'll not say hate anesthesia. You want to be a medicine, but at the same point of time, you are getting anesthesia and emergency medicine. So emergency medicine is one branch where if you want to take a forward seat, you can take that branch, because again, in most of the hospitals, be it trauma, any trauma hospital or any hospital previously that was being managed by CMO are being taken over by emergency medicine people, right? So then there are lesser branches. When I say geriatric medicine, then sports medicine, aviation medicine, these are the new upcoming branches. One branch that most people are not really aware of is respiratory medicine. Respiratory medicine is also very good branch. Post respiratory medicine, you have two options. Either you can do a critical care fellow or you can do a pulmonology. And at the respiratory fellow also, you can do a BAL and bronchoscopic based things. And you need to help the CTVA surgeons with VATS also. We are a TB capital. And when I say if respiratory medicine is not a leading one, I am saying that I am not true to my sentence. So respiratory medicine is really good branch. This is all for someone who wants to take medicine, not getting the rank, but wants to have an edge of medicine, right? So they can choose either of these branches. Few of them also asked about the non-clinical branches. We are going to take a webinar on both the non-clinical branches and the emerging branch on the further few sessions. We have curated one of the most highly professional and practicing physicians. Mostly they are working as a consultant, and they will be guiding you what are the pros and prospects and how they have navigated their career to land that particular position. Most of these people, you'll be surprised to know, they started from non-clinical branch. Like I am a clinical hematologist, but one of my senior, he is from pathology and he is now a consultant hematology oncology and seeing the bone marrow transplant physician. One of my friends, she is a microbiology and she is now in AIMS Delhi as an infectious disease fellow, right? There is this person who has done his, even clinical pharmacology people can do clinical hematology further. In microbiology, people can do infectious disease further. Pathology can do histopath, cytopath, clinical hemat. So the array of subjects are not limited to what you do in these 3 years, right? It is what your final degree and final practice position is. In then you have chosen MBBS to be a doctor, not to be a pathologist, not to be MD medicine, not to be a surgeon, right? You want to practice medicine, right? So whatever lands you are practice position earlier and more convenient is what is the goal should be. So we should choose our branch according to that also, but at the same point of time, you cannot just beat on the more fixed evergreen branches. For that also, I think we have curated a sessions.
Perfect. I think yes, for all of you, what Subham was mentioning, that we have planned it a series of 11 webinars, curating both clinical, non-clinical, and the special topper branch, radio, medicine, Dharma, everything will be discussed there, starting from family medicine to, we have curated a set in such a way that all your questions will be answered, the people who are targeting that. And the way Shubha mentioned, the senior working professionals at the consultant, at the same time, the one who is pursuing it in a college, the mix of people will come and help you out. The way right now the batches of mentors are. So you can just, whichever branch you are targeting, do try to attend those webinars. It will be really helpful for you. Coming back to this thing, yes. So we do have, so I know I have been talking to all of you that give me 2 days, give me 3 days, I'll launch it, I'll finally let you know. So we have finally made it live for Salaah. So I'll put the link here. So there are 2 options. So we have curated it such a way that all your questions and concerns can be answered. So we were there till help you in preparing for NEET and INI. Now we'll hold your hand till you get into your college, because that's very important. Uske liye sari padhai kariye. So there will be 3 things going on. One is webinar to keep educating you and informing you that which branch is suitable for you and why to go for that particular branch. And then comes finding the right set of college on your based on your rank, because round 1 is your motive. You get the college in round 1, max by round 2. So there will be a tool called AI driven book counseling tool. So wahan pe you just have to go and smartly pick your call. Just put your rank there and the branch you are targeting, category you belong to. It will just curate a list of colleges for you, which is very high probability to get, because first counseling is all about filling the college which you have very high probability to get. So the right side of image, that is the whole tool is all about. You just have to get it and you can go there and fill your rank very smartly. It will say ki, this college you have a high chance to get, this is the risky college to get in, and this is the moderate level college to get in. So first on me, your motive should be clear that this is the college I have to target. And the second very important, कि अगर college final कर लिया है, that this and college and branch looks good to me, you can talk to the resident sitting there, and that call will be one-on-one sessions for all of you, whomsoever is booking. So if you are finalizing AIMS Delhi, where Shubham is, so Shubham will have a one-on-one session with you. If you are finding Satrudhan's college, you can have a one-on-one with Satrudhan. इसी तरह you are going to come across lots and lots of consultant or resident in particular college or a stream you are targeting. Have a one-on-one, make your question answered, then make a very smart move of going for college. So starting from giving you generic information over a group call, you can have a figure out your college all alone, and then you can have a one-on-one session. ताकि counseling भी अच्छे से हो जाए और figure out भी कर लो कि whether that college is suitable enough to go. वो toxicity वाला जो factor वो कम है या नहीं है in the college, bond and toxicity. So that's how we have designed the whole NEET PG counseling program. It's like, I'll put the link here, just go and explore it. And if you have any question, I'm always available to bother. Satrudhan, any point to make?
No, I'm getting cold.
Oh, okay, perfect. So I think this is the last one. Uske baad se we'll pick all the questions. We'll quickly go through this and then we'll put all the questions which you have added there in the chat box. Long run, Sagar, Shubham, please. 20-year test, something with the word thrown by Shubham. It's very important because whatever your doctors are doing, it's not for 3 year, 4 year, it's a 20-year test.
So when I say whatever branch that you are choosing, you should ask yourself, can I do this for 20 years? And most important point here is, I quote, with passion. You will end up doing, if you pass up, if you will spend 3 years doing that degree, you will end up doing that for 20 years and more. But will you be able to do it with passion or not? And as we call ourselves passionate individuals or passionate professionals. So with passion, will I be able to continue what I'm doing for 20 years or not? And most importantly, while doing so, will it fulfill my lifestyle? Will it fulfill my demands? Or it will just make me burn out, frustrated individual, right? So the goal is, the right branches, something which interests you and brings the aptitude out of you and also aligns with your lifestyle and lifestyle demands in general, right? This is my take. Whatever branch you are taking, it will stay with you, it will remain with you for life. 20 years is the time I believe you are 25 to 30 as of now. 45 is the age when you just give everything up or you take new challenges. If you are passionate by 40-45 years, you will maybe end up being the CEOs and CEOs of your new corporate hospitals. That is what decides what you will do in the next 20 years. That is what my vision is. And next 20 years or 10 years, if I continue to do so with passion, will I be able to make a difference in my life or in your life in general? Most importantly, when people say they are for passion, as I was discussing with Sagar, the real passion is not when patient. I think there is some maybe pointers towards the patient going back home when you treat them, when you diagnose him, when you see a slide, when you gave that report. But I think the real passion, real happiness is the payday, 30th of every month. Okay. When you hear about that 30th of your salary has been credited, that really makes you happy. Okay. I have done my MD, I have done my SRship. Now I'm in my final year of my DM. I'm telling you this. At the same point of time, what will I be able to attend my cousins or my best friend's marriage? Okay. How many sacrifices will I be doing and for how many years? And is it really worth it or not? It has to be balanced. So for all these 20 years, it is not just maybe in 30 years, we live in India as of now, and by 30, we need to get married. We need to, by 30 to 30, whatever the age is, we need to get married or we should start looking for someone. We should start get serious in life. We are a civil people. So you need to curate your branch, your career around it. The branch is not life. The life is what you live. Okay. Your life is not around the branch. The branch is one part of your life. The job is one part of life. You just go to 9 to 5 job. Think of you as a clerk. Degrade yourself a bit. Think of it as just a payday. You just go visit a hospital, it pays you back. Since we are nice people, we honestly and passionately work there. And we just don't go and spend our time. We bring back the work home. That is what we do. Because we are passionate individuals. But at the same point of time, we have to be realist also.
Yeah, I think
I want to add one more thing. Like Subham said, this long run reality check. I want to add that before giving the NEET PG exam, we all have thought like I want this branch, and after clearing this exam. But according to me, the real fight begins when you completed your post graduation. So don't think about कि अरे यार ये branch चाहिए था मुझे मिल गया बस अब तो कहानी खत्म. The real thing. So from day one of your PG residency, I know you will not get so much time, but at least take out some time to get it checked what you want other than these things, because sometime it will happen that you will feel so much of loneliness and so much of stress. But if you have something to look after these your professional thing, then definitely you will feel relaxed. So try to develop some extracurricular thing. Try to get into some other things apart from your professional life, so that it will take you to this 20-year test and it will take you long forward. Because ऐसा कभी-कभी होगा कि तुमने जो बहुत passionately branch ले लिया था, उस branch को लेने के बाद तुम 5 साल बाद तुम खुद feel करोगे अरे यार मजा नहीं आ रहा. क्यों मजा नहीं आ रहा? क्योंकि हम एक ही चीज को 10 बार करते करते कहीं एक point of time पे हम पक्का feel करेंगे. लेकिन apart from this, if you have something कि जिसमें हमको थोड़ा हम उसमें जाके टाइम पास कर ले या हमको उसमें भी वो काम करने में भी थोड़ा मजा आ रहा है, तो डेफिनेटली you will feel like something कि अरे यार I'm very ready for these things. So for your profession, try to develop something out of profession so that it will gonna help you in your profession.
And for doctors के लिए society ने ही number शादी की बढ़ा दी है. Now it's not 30, it's 35 for doctors.
I believe those who are getting married post 35, they are in need of doctors.
Because I'm telling you, even if you'll just go and open any matrimonial site for doctors, सबका age 34 से 35 में ही सबसे शादी कर रहे हैं. Society ने भी accept कर लिया. उसके पहले doctor करेगा ही नहीं, time ही नहीं है.
नहीं यार, ऐसा नहीं है यार, लोग जल्दी भी कर रहे हैं.
Shubham is getting married और Sagar अभी April में शादी किया है. So that's why they are saying.
No, the point is कि over the long run, it should really get you what you want, right? We end up saying that the important question that I think Satruhan and Sagar were speaking about. We and Astha, myself and Astha and Sagar, we are trying to curate the data for Pan India. We are not just want you to get into the NEET examinations and then get into your best college or branch of your choosing. We are also planning to help you in and out, because as Sagar mentioned, it is कि अभी किसी ने शायद चैट में मेंशन किया कि लड़ाई रुक ही नहीं रही है. हाँ, तो मजे जो है ऐशी ऐशे वाला टाइम आएगा ही नहीं, है ना. तो व्हाट वी कैन डू इज कि हम एक ऐसा इकोसिस्टम क्रिएट करें कि ये हम ऐसा पूल क्रिएट करें कि वी हमें आपको हेल्प आउट कर सके, है ना. नॉट जस्ट इनटू गेटिंग इनटू पोजीशन, but how to navigate your residency, how to get positions post residency, and then again post residency also how to navigate into a particular fellowship position or a DM position or a corporate position or academic position, right? Because it does not end. Post MD you will fight for SR positions, post SR you will fight for AP positions, or someone who has an academic predilection or a corporate predilection. Then someone who is practicing in the periphery or who is in the periphery, they might understand and know about the tout practices, about the referrals, about the networks. It is vast. It is never ending. Wherever you go post, even if I complete my DM and I start my practice, again I will be in 0 year, right? So we have made so Astha will be better be able to tell you the MBAs and the engineers, they have all the data sets for all the institutes, for all the workplaces, from the CTC in hand to the work profile, work toxicity, how the bosses are. Someone were asking, how can I navigate through? How can I navigate through various branches or colleges? Do I need to? Someone also mentioned, can I get the numbers? How to get the numbers of the DNB institute people or a MD institute people? So that is something we are trying to curate at one place. Maybe in few times we can get it done for you, but the overall point is we need to stick together, right? We are just a call away, a text away, and a lot of us are like that. I think I have asked someone, I have cold mailed someone and they have not replied. That has never happened. You just ask someone randomly, I have got this number from Satruhan, can you just help me out? He has never heard of you. You will never hear it back from him also again after that call. But then again, he will respond nicely to you. So why can we not make this system more easy, more convenient for us?
Yes, Shubham, adding to this, and doctors in general are, I think they're trained in such a way that they are always ready to help. Yeah. Because the whole system have taught them to be very empathetic, become this like help the patient. You have this responsibility to serve back to the society. So even if in general falls back to कि तुम्हें किसी junior की help करनी है, they're always ready to do it. At least that's my experience till now with all the doctors I have come across. I'm very fortunate. All of them are like super helpful and super nice people to work with. And the coming back, the point is that at least if you go to the engineering management, I think they have solved this problem way back for themselves, because it's a very human connection, or the connection in the community is a very important need anybody have. And if I get a job somewhere, it will just take me a day to figure out the people working in that company, to talk and figure it out कि वहाँ का मेरा manager तक कैसा है. And this is missing in whole the medical field, because finding one another, talking to one another, it's a challenge. And that was the whole plan behind it, connect these people who are living in isolation and silos, and started small, and now we are just growing one by one, bits by pieces. One doctor is adding at a time, and that's growing. But the whole vision is कि आपको अगर किसी doctor की जरूरत है at any point of time, you have your peer just a click away. That's the simple mission.
I think we should switch. We should revolutionize the way we think. We should switch from being competitive to collaborative.
That's very important.
Right. Once we do that, things are going to get easier for all of us. In one way, we can make things better, or we can just cram in this webinar. The things are not just right.
Right. It just look at this. Satrudhan is just an example in front of me. वो अपने night duty में. He should have been doing his night duty. But I just called him that Satrudhan, please आ जाइएगा. And he is just here sitting, like taking away his 1 hour from the duty. So I have come across these type of doctors only. And I think
we have seen also like so many mentors we have their first year residency and their mentees are craving for them and they are taking the session in 3 o'clock in the morning. Just because they want to help. So that's what we are planning to build that कि एक डॉक्टर को डॉक्टर ही हेल्प कर सकता है क्योंकि बाकी की दुनिया तो उसको पीछे खींचने में लगी है. तो इट्स बेटर टू क्यों ना डॉक्टर्स ही एक दूसरे के लिए हेल्प बने क्योंकि आने वाले टाइम में कोई नहीं पूछने वाला, जस्ट डॉक्टर्स ही डॉक्टर्स को पूछेंगे.
Yeah, because just look at the amount which will transact in between that. वो कुछ नहीं है numbers आप लोगों के लिए. The amount, if you'll just talk to a patient, at least doctors की बात है. अगर आप कोई patient देखते हो for 1 minute, you ended up charging 500 bare minimum. तो tier 3 cities में भी है. यहाँ पे they are talking to half an hour, an hour. With that cost, वो पैसे के लिए कोई काम ही नहीं कर रहा on this space में. It's just a token of gratitude or seriousness is passing on to them. But it's a lot more than that. The satisfaction and the feeling of passing on and serving back to our society, it's driving this whole system. So I think we'll switch from this now to Q&A. There's a lot of questions waiting here. So आप लोग चलो starting है. Yes, one question Satrudhan, कि sir, because I think you were there in the last round. अगर मैंने round 1 में seat मिल गया है and I can opt out for upgradation, then also I should go for my college to report and join and do all the process?
Yes, you have to. That's the hurry. One more thing I should add, okay. Plan your travels, okay. Because if you are putting up a list of the priority list, you should have a clear-cut idea whether you can reach that college or reach that location in time or not. Okay, if you will get it. That's one more mistake you will have. So yes, you need to do the whole process in the upgradation. While in some college, you will have to submit the documents, then you will have to come back to get those documents. In DNB, I think in few colleges, they don't ask for the documents. Few institutes, they have their own thing because they will let you go, okay, you can take the documents and if you did not get upgraded, then we will, they are really cooperative. In DNB scenarios, like corporate or some, not the government officials, not the government colleges, but some corporate DNB hospitals, they are very cooperative in that. So you, okay, if you want to upgrade, we will get the verification online and we will say it like that, okay, thumbprints and all, we will do it later. You can go to your second round. But please, you have to research on that, whatever your list is, because many will not. And you will have to travel a lot.
Yeah, and Satrudhan, the money which we put for a security deposit, वो कब refund आती है?
I don't know. I'm waiting on mine also.
That comes after all the sessions have come, and I think post 6 months, that
Post 6
deposit gets the bank that you have given should be active. It comes after.
The NEET PG counseling money will get back after all the rounds. I thought the DNB money 1,25,000.
If you leave the seat, it gets forfeited.
Yeah.
Oh, no, but if you get upgraded, then they will.
If you get upgraded, then no. If you leave the seat, then it will be forfeited. Forfeited. If you follow the natural command, whatever they have made the system, it will not get forfeited. If we leave the seat, because DNB में seat leaving bond नहीं है, if you leave the seat, it will get forfeited.
And you will be banned for next 3 years to sit for DNB counseling.
DNB. You will not be banned from doing NEET. You will be banned
for DNB
institutes. Someone has asked this question, I guess so.
Yeah, I think, yeah. And there's one question, if you can please respond, are deemed institute good compared to state private colleges for the amount they demand for general surgery? Deemed institute versus state private colleges for general surgery.
I think deemed are better.
Yeah, deemed are far better than these private hospitals as compared. But it not always, because if you go to the southern part of India, you can have some good private colleges where there is a lots of hands-on, because in southern part of India there is a rule that half of the seats, half of the bed, they are giving it for the general population with a very minimal charges, and half of the bed will be for the those people who can pay for it. So there will be more chances of getting hands-on in general surgery if you're going to southern part of India. If you're going to Maharashtra and all side, there will be, if you take DNB colleges, then it's far better than getting the private colleges there for general surgery.
Someone has asked at 11K chances of getting DNB made from Guwahati, Assam. Is that good? And actually, I'm from Maharashtra. Regarding is Guwahati good? DNB medicine from Guwahati is good or not? That is something we can curate for you. But the chances of at 11K, whether you will get DNB medicine or not, you can try the forum that they have made. Astha, have we?
Yes.
We have launched that, right?
Right, yeah, it's available. They can just go and put their rank.
Go and put their rank, and they can get a possibility whether you'll be able to, whether it's a safe chance or not. They have divided if more than 80% of you at same particular rank previously from the previous data only. If you can get that at particular your rank or not. I think you can try that one. I think Dr. Devgan has asked that question. Yeah.
There's a hell lot of logic going behind that, whether you should get that college or not. And I think that will give you a good enough prediction to that you will get that college or not. Okay, let's talk about the language barrier during the initial phase of residency, because there's a little bit reluctance there in people that should I go for Southern India colleges, or should the people from that southern part of India should come to North India for that language barrier and all.
With respect to language barrier, let's say
in the phase of residency.
Let's say most important thing is now what branch you are choosing. Let's say the branch which has one-on-one interaction. Okay, there might be have an initial language barrier, but over the time one get adept. Okay, because even in South, for let's say there are few starter questions that you need to understand. And then it will be difficult. Obviously, it will be difficult, but it won't be a major problem when it comes to choosing a branch. Secondly, when someone who's coming from South to Delhi, maybe in North, I think that is not really a problem because most of the people here speak English within the colleagues. And at the same point of time, you will learn maybe Hindi and able to have some kind of juggles between the Hindi and English, and you can manage. This question I really wanted to take. If I took MD non-clinical subjects this year in All India quota, will I be eligible for NEET PG 2026 year examination? Yes, you will be eligible for the examination. But then again, if you really want to take MD non-clinical subjects, why do you really want to take the examination again next year? One. Secondly, if you leave the non-clinical subject, you will have to pay a hefty amount of seat living bond that you will be living for that particular subject, depending upon the state and the institute.
In coming back to, can we have something on anesthesia also, because there's a branch anesthesia people. Okay, let's we'll cover it that time. There's one question: what do in general corporates prefer, a MD or a DNB graduate?
So Sagar, would you like to go ahead with this answer, or shall I go ahead?
Yeah, I'll give a few examples. Like few of my colleagues have got working in a corporates. So it's totally depend on in which under which doctor you are working, or if you're going for some department over there, most of the doctors are MD or DNB. It depends. But talking about the corporate, they are more going for the DNB because they have already the DNB seats there. So they're going to prefer the DNB people as compared to the MD. But it will be totally different in government colleges, government medical colleges.
So for that question, let's say you do a DNB from a particular institute. Most of the time it does happen is you get absorbed within the same system. Someone who is, if you are doing it from a good institute, you have a good reputation with your attending, and for whether it be at a medicine branch or a surgical branch, for any of the branch for that matter, if your reputation proceeds, okay, whatever you did, not just because you have passed from that institution, they will take you. What you did since the last 3 years, how good you were and how hardworking, how promising you were. They will choose the most promising candidate. They will not choose just because they have passed from their institute. If you are the most promising candidate, they will choose you any day over an MD. Because that MD resident, he has to then again relearn the system, and then again, whether or not he will stay long for not. So the medical community works on goodwill. Okay, okay, this is person I like to work with him, I'll work with him. So most of the time, whether it's corporate or not. Now let's say the right question is for consultant roles, for head of director roles, it anyway doesn't matter, because that positions will always be open for someone who has a vast experience and a very good academia.
So, Shubham, there's one more question. It's a condition for everyone, like all three of you can give their point. If someone is not passionate about any particular branch, will taking drop for one more year is advisable, or take something at your rank and get out of the rat race? So,
If someone is not
passionate about any particular branch,
if
any
they are
branch
not
will work.
passionate about medicine, leave medicine. There are better opportunities than medicine. When I say this, yeah, don't waste your life with medicine.
Don't waste it. Don't waste another year.
Whatever is your calling, go ahead with that. You don't need to pursue what 99% of the people are doing. You can be an outlier. You will be the happiest of all. It's just that you need to find your calling.
And if they don't know the calling,
if they don't know the calling, text me.
I'll help you in getting in touch with Shubham. But yeah, आप क्या बोल रहे थे सत्रुदन?
I was just, why would you want to suffer again if you are not passionate? You need to have passion to go through one more year and another year. Why? It's just a basic thing. Do something else. What the sir has said.
When I tell you, Satrohan, the people who are taking drops, they will. I can present a data basically on this. So, statistically, the people who are taking more drops for a particular branch, more than 2 drops per se, for a one particular branch, they will always lag behind from their peer groups.
Yeah, I had my senior in Gautam Nagar. Okay, he was taking drop for past 6 times. Okay, I have witnessed him. He wants to get into radio. Okay, and he was getting a rank around 5,000 or 6,000 in his first attempt. As the attempts were getting more and more, the next time he got 7,000 rank. Okay, I want a DNB surgery from Delhi. Okay, then he got the rank of 11,000. The DNB surgery closed at 10,000 that year. Okay, he did not get. I will get DNB surgery from a good institute. The next year rank drops to 22,000. So the stairway effect was there.
Let's presume he cracked at whatever the branch he wanted in his third go. Let's presume that he got into radiology, particular institute that he wanted. The problem with us, we don't compare ourselves with juniors. We compare ourselves with our batchmates that are MBBS.
Yes.
Okay. So that is something we are all aware of. And over the time, what does brings the best best in us is our confidence. This takes a very big toll in our confidence while practicing. Then you have to go through the residency. Then again, I'm not saying that there is an age problem with that. I'm not generalizing it, but I am actually pointing out the elephant in the room, that rather than just doing the more drops, I think what we should do is we should try to understand what we want in general in life. And at the same point of time, there are always opportunities for an MBBS graduate. There are opportunities that you will not understand that is open for you. You will have the least amount of respect in hospital, and once you step out of the hospital post MBBS, you will be a leader in that particular domain. That is true. And in a paying figures and salaries that are higher than your colleague. Options are MBAs, CMEs, research, medical writer, pharmacology license. There are
WHO representative. Those jobs are also there.
Not medical representative. It's a medical license. Let's presume there is a new drug. Let's say that there is an IDH1 molecule. So for that, a research has to be for Indian patients also. Let's say US-based company has made one molecule. That molecule is being maybe made by Novartis or Pfizer. For that, you need a clinical medical license. He should be a researcher. He should have a basic knowledge, technical knowledge, and then he will lead that particular he will bring the scientist and medical representatives. So he's a liaison between the medical representatives and scientists. And he'll be paying, he'll be traveling the world, he'll be presenting papers in all most of the institutions and conferences, and he'll be much younger than you and but happier than you.
I have
See,
met
there is
one in NEEMS. She was very happy in her 30s.
and see, now there's so many corporate options also open up, like so many health tech companies are working. So even if you're coming from a public PSM as in general as a branch, there's a lot of companies hiring Vadhwani ho gaya, Cure AI, they are hiring doctors who have PG in PSM. In general, if you'll go to KPMG or the consulting firm, the Ayushman Bharat Mission, multiple opportunities there also in the corporate for the doctor who want that gist of both tech and medicine. Coming back to this question is coming again and again in different forms. If I don't have a good enough rank this year, should I take any branch this year and sit for again NEET PG 26? Or should I just leave everything and just start preparing? Agar rank kharab hai, to you should better start preparing. Or else if you want to take a college, go on the college with your full heart. If you are trying to sit on a two boat at a time, that will come at a huge and hefty cost. First year residency, I think any branch you will take, it's going to be demanding. And at the same time, you are preparing for something that difficult as a NEET PG. So demanding residency, you are preparing day and night for the NEET PG, and then you are ready to pay the hefty amount again. And that all for what? Like, what is your why to do all this, go through all that? I think Shubham, Sagar have a better reasoning behind that. I'm just telling from a very outsider point of view that why should I put myself in this pain and lose that much of my money? Like, what is my why to do that?
If you're not happy with that particular branch which you are taking and you're going to appear for the next year NEET PG, it's better to not to take that branch and join some job. And with that job, prepare yourself. And before 3 or 4 months of the NEET PG, you can leave that job and you can continue your preparation. Because if you continue just studying for next 1 year, you'll not have so much of efficiency. If you'll join some job and have your regular routine, like you are doing the job for 6 to 7 hours, and after that you are sit and study for 5 hours, it's more than enough. So there's no need of joining any branch. It means you are wasting one seat. Many people who have got more than 1 lakh rank, they are really want to take that particular non-clinical branch. Most of people have messaged me, and from last 2 or 3 years, they used. I have got so many calls like, I have got 1 lakh rank. I want MD anatomy. I want to MD anatomy only. But because of these things, people are taking MD anatomy and thus they are preparing for the next year NEET PG, and they are clearing that NEET PG. They are going to join that particular other branch. Then that seat will be wasted, and those people who are really want that MD anatomy seat, they will be suffering like hell. So according to me, if you really want that particular branch and you have not got that good rank, join some job where you can do 6 to 7 hour job and sit and study and go for next year NEET PG.
I'll differ from both of you.
I just wanted to ask something. So I just want to say this because of my personal experience. Like last year, I got a certain rank and it was not very expected like I was. And I prepared very nicely this time, whether getting good GT rank, even going through main notes in some subjects, not even rapid revision, like give it all, like whether you talk about Anki cards, everything. It still end up on the same rank number. Like you can just say 100 or 200 here and there after a year. So I don't know, like, so because this discussion going about like whether a person should try again or not and something, it's a very like, because I've personally gone through it, so I have like realized that what's gonna happen next year is very uncertain. Like you can never know like how tables gonna turned out. And just talking about, and plus especially in India where like things getting so complicated, AI is just coming up and a lot of people, so now there's a lot of opportunities. It's just not about a lot of now people are hiring medical doctors from every profit branch in their startups. So is I think it's better, I personally feel that to move out of the race rather than going, because this race anyway is not going where like it should be. And personally मेरा राय है तो मैं तो खुद like because sometimes you prepare more, like more than the current year preparation sometimes, but still there's chances that it's not like that you're gonna massive jump, because we see a lot of stories कि किसी ने 10,000 से 1,000 पे पहुंच गया, 1 लाख से 2,000 पे, but there are many who 10 to 30 पे भी चले जाते हैं, 20 to 50 पे भी चले जाते हैं. वो स्टोरी कोई नहीं बात करता है, और वो बहुत होते हैं. It's not like that's very limited. So it just
it depends
it's a very
कि
50-50.
वो कितनी बार ड्रॉप ले लिया. अगर किसी ने इसी चीज को लेके 3 बार 4 बार ड्रॉप ले लिया, तो there is no need. If someone has just given her first attempt and got 69,000 या 80,000, then according to me they should take a drop and give a chance to them, because वो फिर बाद में एक अफसोस रह जाता है, यार एक बार ट्राई नहीं किया.
हाँ, मतलब इंटर्न हो, लाइक इतना प्रिपेयर करके नहीं दिया, then it makes sense. But yeah, but yes sir, Shatrughan sir want to say something. Yeah.
I just want to say, okay, it is a very subjective question. Okay, I needed 30 minutes to talk to the person. Okay, regarding the last year attempt, what he has actually done. Okay, you can say anything. I have done this. I have done that. I have just talk to me. Okay, like a lie detector. I have to analyze. Okay, what ask some serious questions. Whether you have done this, whether you have done that, then an objective answer can be given. Okay, you should take a drop or not. I have done this with my juniors. I have done this with myself only. Then only I could get selected. Okay, look, you have to be very critical and very objective regarding the questions. Efforts are really subjective. All of us are putting efforts. That doesn't matter. What matters is what others are, how our efforts are comparing to others. So to get it is a very objective thing to say, okay, whether you will get selective or not.
Very
In the next year.
As
Very
we
true.
say,
Yeah.
as we say, is you are 100% the actual 100%. See, okay. So
Who gonna decide this? Ki your 100% is 100%.
The toppers marks from which the percentiles gets decided.
Yeah, so very true. And all of you who have this question of like, because it's a very important decision to make right now, that should I start preparing for a next year or should I go for a college? Counseling में जाओ अगर college लेना है, अगर नहीं college लेना है, so don't waste your time here and there and money here and there. So whatever decision has to make, please go through a lie detector. The Shatrughan के पास है. I have had a word with him.
I didn't have a lie detector. I just want to. This person needs to book a session immediately.
And I'm telling you,
all are not priority.
He
This
has
person
a whole.
needs it.
He has a whole matrix system with him. It's like a 5-6 column matrix. He has shown me that, like, Asta, you have to get test people here. If they are there, it will take this much effort to move from one box to another box. So it's a very subjective approach for sure. So whomsoever have this dilemma in mind, please have a one-on-one session with Shatrughan. Book a 30-minute Shanti se time of his.
I'll only take it one.
Yes.
I'll only take one.
Because it really gave a lot of clarity, because while I was building something, a solution I was designing, it was such a mind-blowing sessions for me too, to how to design or how to match people in long mentorship. It was all about how to match one mentor with another mentee for long mentorship program. And it was a good crash course for me for half an hour.
We had, I think, 3-4 sessions regarding that. Okay, how to objectively determine whether a mentee is genuine or not.
Definitely. So Surbhi and others who have this question, it's a very, very, very important decisions to make. So please don't go for generic opinions. Have a decision which suits you, because career is a very personal journey. So have a one-on-one session with Shatrughan. Yes, Bhavesh is going to start that thing. But I think there's Sapna have raised her hand. Please, Sapna, ask your question and then we'll close this up. We are already 15 minutes ahead. And if anybody have any last question to ask, feel free to unmute and ask.
Thank you, ma'am, for the opportunity. Good evening to all the mentors here. And I would like to ask Dr. Shubham, sir. Sir, रेडिएशन ऑन्कोलॉजी के बारे में जो आपने अभी बताया था सेशन में, so this is for the first time that I'm hearing. Please मुझे क्लियरली गाइड बताइए कि रेडिएशन ऑन्कोलॉजिस्ट का क्या काम होता है और रेडियोथेरेपिस्ट का क्या काम होता है. What is the difference between the two? क्योंकि रेडियोलॉजी पर से तो जो हाईफाई रेडियोलॉजी रेडियो डायग्नोस्टिक है वो मुझे पता है कि क्या है, लेकिन रेडियो ऑन्कोलॉजिस्ट और रेडियोथेरेपिस्ट का क्या रोल है, वो अगर आप मुझे क्लियरली बताएं तो चूज करने में इजी होगा. आई एम अ मिड रैंकर राइट नाउ.
Both are same, MD radiotherapy versus radiation oncology, depending upon where you choose that branch. If it has to be MD radiotherapy, MD radiation oncology, okay. Both on day-to-day basis deals on dealing about the all kinds of, let's say if you are in a tertiary care center, most of these hospitals are associated with tertiary care hospital, meaning medical college. And then most of those hospitals are also associated with apex or regional cancer center. Okay. In maximum institutes, see, I did my MBBS from GMC Raipur. So we had that regional cancer center in Mikahara as a, and that was being managed entirely by radiation oncologist or radiotherapist. Okay. So the thing is, you are MD medicine with etiology in cancer.
Okay.
In one line. Okay. So you are MD medicine with etiology as a cancer. You do end to end. You treat not only with chemotherapy, you treat with radiotherapy also.
Okay.
And you can stay as a radiation oncologist only. Okay. Or you can subspecialize in medical oncology. If you want to practice radiation only, you want to cure patient via radiotherapy only, you stay as a radiation oncologist. At the same time, you are legit to prescribe chemotherapy too and work in a oncology setup.
Okay.
So an oncology setup in general requires 3 core treating individuals: a medical oncologist, a surgical oncologist, and a radiation oncologist.
Okay.
So there is a thing in oncology particularly called as multidisciplinary tumor board, called as MDT. No patient, when I say not difficult patient, no patient gets or his treatment plan is decided without sitting in MDT.
Okay.
So you have an equal say. It's not just that you are important or medical oncologist or senior person, so they get to decide. The MDT gets to decide what is best for the patient. Let's say for some carcinoma or some tumors, radiotherapy is the best choice. They will say, okay, ठीक है, हम debulk surgery करेंगे, radiation oncologist इसको देखेगा, handle करेगा end to end, है ना? फिर कुछ में रहता है नहीं यार, हम पहले कीमो देके बल्क करेंगे, फिर सर्जन सर्जरी करेगा, फिर आप कंसोलिडेट कर देना रेडियोथेरेपी के बाद. So basically you work in liaison with medical oncologist and surgical oncologist.
Okay.
Okay. So radiation oncology in terms of prospects, it's a very upcoming branch. Since if you want to go through the statistics, you should go via Globocan data, and you should specifically look after the Indian cancer statistics. You will be better able to understand how many physicians, how many practicing physicians are there, particularly for cancer specialists are there, and then how many new patients are coming. Mind you, no oncology patients are being treated with medicine guys. Medicine guys won't touch. So it is a branch which is only, the patient subsets are only for you. Now, between you and medical oncology, it entirely depends on at what level you want to specialize. So that depends entirely then again on you and how much hardworking you are and how many years you can give to a particular field.
Okay. तो सर अगर सिर्फ रेडिएशन ऑन्कोलॉजिस्ट की तरह काम करना है तो वो कर सकते हैं, अदरवाइज सुपर स्पेशलाइजेशन
definitely. Okay. Very defined role. There is very defined role. If you want to jump into a role of medical oncologist, then you won't be practicing as radiation oncologist. Once you have done radiation oncology followed by DM medical oncology, so you will be in a medical oncology shoes. I am talking this in corporate hospital, big hospital where the decisions are very specialized.
Okay, I think we'll pick the question from Sakshita. Sakshita, please unmute and ask. And then there's one last question we'll pick on emergency medicine as a career option. That too, the last question.
Okay. Yeah. Good evening to all the panelists, and thank you, Astha ma'am, and everyone for organizing this session. My question is to Shatrughan sir. Sir, like you answered that once we join, once we get the seat and we reported documents, like we have to join the residency immediately after that, or like if I have chosen to upgrade, I can join after round 2 or round 3.
See, in round 1, you have the choice. Okay, most of the institutes, be it government or any corporate, they will not heckle you. Okay, you should join. You should join immediately. But after round 2, many institutes will force you. Okay, you should join our institute. If you got upgraded, then you will be asked to leave. But it's a very subjective thing. Depends on institute to institute. But in the starting of counseling, you will be free. Okay, from first round and second round, you will not have this problem. After in the round 3, basically this problem will arise that many of the institute आप अपने आप से join कर चुके होगे. The real scenario is you will have joined at some place and started your residency. A third round will come later. But the thing is, last year, because last year the date was 20th of December in my time, there is a specific date of a specific round. Okay, after round 2 results or a particular date will come, all India candidates have to start their residency or their session will start. After a certain date, the state counseling, all the residents will have to join from that particular counseling and their session will start. So if that date is not breached, you will not be forced by anything to join the institute. I joined on the last day in my counseling. I lagged it till the last day, and I advise to do that same. Because it's not a very happy thing to be in residency.
Okay. And just one small question to everyone. Sir, can you please address the bond system, like which is going to be started from our batch? Like in most of the states, it is coming up. Like, do we have to give the bond money initially itself? Like, I can't get anything about that. Like, what is this bond system? Or if you can bring it up in the upcoming sessions in detail.
In details, Akshita, for sure, I'll pick it up. Taking that question, that's on my head. Bond system explain karna, I'll pick it up. Anybody right now, if any have information about it, we can share, else we'll pick it up in the later part.
Ma'am, I can help you in this a little bit with bond.
Yeah, sure. I'll get in touch with you. We'll create this thing, the bond system wala, like a well-versed we'll create later. Rather than giving half information, let me have this surety there. We'll pick it up. One last question about emergency medicine, please. How in general emergency medicine as a branch? Thoda sa, just a glimpse of it, because this question is coming repeatedly.
I think the residency is same for internal medicine and emergency medicine people in their residency period. Mostly it will change later, because they have the same kind of workload, just the degree name is different, I think. For me, because emergency medicine is not in my college, but it's in peripheral college in AIIMS Gorakhpur it is, because there are emergency medicine. They are the first to get the patient. Okay, they will be posted in emergency, and they will have a very hectic, I think, time schedule from us. So they will be there only. But in corporate in Delhi side, I think the things are much better, I presume. I don't know about that.
So emergency medicine in Delhi or in particular any hospital, it's a first medical contact, number one. Secondly, with regard to hectic, they have the most easiest duty. They have very strict time schedules. Let's say morning, evening, night hai, morning, evening, night hai. If one is in first year, does not necessarily mean that he will do 24 hours. So there are very clear morning, evening, night schedules are there with respect to government institutes, with respect to DNB Institute. One of my friends, he did his DNB emergency medicine from Max. Now he's a SR in AIIMS Delhi. The work, and then again he worked for some time in a MAMC. So at the same, the point is you still have positions open. Okay, so it does not necessarily mean that someone who has done his MD in emergency medicine gets position in one of the good hospitals. Since the branch is new, you need to understand the emergency medicine is very new branch. So all the positions will take some time to saturate. So until that is happen, you will get opportunities. Even post then there are new opportunities, because the NMC guidelines are changing and they have incorporated that all the CMOs will be replaced by emergency medicine people, right? So you will always have a SR position open, and then again the faculty positions are also open at most of the institutes. With respect to corporate practice, every corporate practice needs an emergency physician. What are the post MD qualification? He can always do critical care in a DM. Okay.
Perfect. Okay. Sagar sir, there is one question for you and then we'll wrap it up. In DNB general surgery, can we get super specialty rotation also?
Yeah, most of the hospitals have their super specialty department. And if that hospital doesn't have, they have a MOU signed with the medical college, so that you can have that rotation in that particular medical college nearby your hospital.
Okay, perfect. I think I'll close this up, and thank you Shatrughan, Shubham, Sagar and Abhay for coming here and taking the session. I'm really grateful for you to start this mission. This is the first call to start with, and you all have rocked it. I think I should say drug it because it's a very fun talk for me to attend. So yeah, thank you for coming in, and thank you for all of you. If you have any question left, they are all accessible to you. And if you don't know the way, reach me out, ping me, and else just go to the Salaah website. You will figure it out. And counseling starts. We will try our best to ease it out for you as much as we can. But अगर कुछ रह जाता है तो माफ कर देना. We'll pick it next year. So, chalo, thank you all. It's already 11:30. Satrudhan will continue his duty, and rest Sagar and Shubham, आप लोग senior हो चुके हो, chill करोगे, सो जाओ.
नहीं यार, ऐसा नहीं है यार, सुबह ड्यूटी जाना होता है यार.
चलो फिर, thank you so much. Bye. Good night.
Thank you so much.
Bye. Good night, everyone. All the best.
Yeah, good night, guys. Thank you.